Are we starting with the announcement?
Yeah.
Oh. Hi, my name is Katya, and I am one of two Spanish interpreters. The other one is Alexia, and we are part of a collective called the Los Angeles, and we will be interpreting to Spanish today.
Hola, yo soy Katia, soy una de dos intérpretes al español, la otra es Alexia, aquí está, juntas somos parte de un grupo llamado Antena Los Ángeles.
We based on the language justice framework, which is the idea that everyone has a basic right to communicate, understand, and to be understood in the language they feel most comfortable in.
Trabajamos basadas en la idea de la justicia del lenguaje, que es el derecho que todos tenemos de comunicarnos, entender y ser entendides en el idioma que nos sentimos más cómodos.
Today, our capacity is to provide Spanish interpretation, but we are aware that there may be many other languages represented both in this meeting and among the people who are watching us, and that we are on indigenous lands where there are other languages that have been disappeared in violent ways or continue to struggle.
La capacidad que tenemos hoy es trilingüe. Vamos a estar interpretando en español y en inglés. También tenemos idioma de señas, ASL. También queremos reconocer que hay otros idiomas presentes porque estamos en tierras indígenas y estos idiomas pues los queremos honrar porque han sido invisibilizados por diferentes procesos de colonización y desplazamiento.
So in addition to providing spaces where people can communicate in languages they feel most comfortable in and honoring all the languages, we also believe in language justice being a shared responsibility of everyone.
Creemos que la justicia del lenguaje es una responsabilidad colectiva, entonces hablaremos un poco de eso.
So there are three major ways actually in which you can literally provide us a hand. So usually you would see all our faces here, but if you see the interpreter with a panicked face making this sign like this, that means that whoever is speaking should speak slower so we can interpret.
Hay tres formas en las que literalmente nos pueden echar la mano. La primera, que es una muy importante, es pues generalmente pueden ver las caras aquí. Si ven de repente al intérprete con una cara de pánico haciendo esto, significa que por favor el más despacio para poder interpretarles.
If you see us do this, that means if you're speaking, you may have to do something so we can hear you more clearly. So maybe move the mic closer to your mouth or speak up so we can interpret.
Si nos ven haciendo esto, significa que por favor hablar más fuerte, tienen que hacer algo relacionado a su sonido para poder escucharlos mejor o más claramente.
And finally, we ask you to mute your mic if you're not speaking, as that will also make it easier for us to hear whoever is speaking.
Y también les pedimos a las personas que están aquí que por favor le pongan mute a su computadora, teléfono, para poder escuchar claramente lo que se está diciendo, para poder interpretar.
So up to now, this has been consecutive interpretation. We're now switching to simultaneous interpretation where you will be able to hear everything that's being said almost in real time in Spanish on the interpretation line. And you can find the information how to connect in the chat box.
Hasta ahorita estamos haciendo interpretación consecutiva, vamos a pasar a ser simultánea, en donde van a poder escuchar casi en tiempo real lo que se está hablando, pero en español, y van a poder encontrar la información de cómo conectarse a la línea en la caja del chat.
This is all from us. Thank you again for having us again and for allowing us to support the space. And we hope everyone is going to have a great meeting. Thank you.
Hi, you all. This is Sly Pham. I'm the Digital Media Coordinator at Transgender Law Center. Thank you, Alexia and Katia, for making sure that our Spanish speaking family can access this call. We also have ASL interpreters, MJ and Carolyn, who are on also to make sure that folks who have disabilities can also access this space. It's incredibly important in this time, but always, to center disabled voices and to ensure that disabled communities can be a part of our organizing. So we're really grateful to have our interpreters on today. For this week, we are on our fourth week of virtual gatherings that we've started in order to connect with you all and to break isolation in this time where so many of us are feeling loneliness and despair. And so for this week, our legal team will be discussing really important life planning documents so that we can prepare ourselves and our loved ones in this time of crisis. You can see the resource in the Facebook comments. There's a link to that resource. So first, I'm going to pass it to my colleague, Dale, who will kick us off with some information. Dale, are you ready?
Thank you, Swag. Welcome, everyone. My name is Dale Melchert. I'm a staff attorney at the Transgender Law Center. I use he, him, and they, them pronouns. And today, our legal team is going to discuss the resource that Swag just mentioned, which discusses different legal documents that are important to support your self-determination and dignity during the most vulnerable times in your life, namely in the event that you are ever incapacitated. During this call, we will go through each document, what each document is, and why it's important for transgender and gender nonconforming people. This resource is available on our website, and we will also briefly touch on some important aspects of emergency planning during the call. This can be a hard topic to discuss, especially in this moment where we are experiencing so much loss and uncertainty. So please take care of yourselves. If you need to take a pause, please do. This call will be posted on TLC's Facebook page, so you can come back to it later if you like. I also encourage you to check in with yourself throughout the call and take care of your body. If you need to stretch, drink some water, eat something, please do, or whatever you do to take care of yourself. So we will be discussing end-of-life care and ways to ensure that your healthcare wishes are followed, and know that it is common to be unsure what your wishes are when you first start thinking about this topic. Deciding what your wishes are is a process, and there are no right and wrong wishes. All of the resources we are discussing today are deeply personal tools for your own self-determination and about how you want to be treated in the most vulnerable moments in your life. So I invite you to take time to sit with this information, reflect on it, seek out more information if you need it, speak with somebody you trust, whatever works best for you. And thank yourself for engaging in this process, as hard as it is to contemplate your own mortality. You are preventatively taking steps to ensure your self-determination and dignity. And it is much better to have these documents ready to protect yourself, even if you never need to use them, rather than scrambling in the unfortunate event of a crisis and trying to put them together. One more thing before we jump into discussing the different kinds of documents is to note that the resource we created is very general, and we discuss the documents broadly. However, each state has its own requirements to ensure that these documents are legally enforceable. So I encourage you to check on your state's resources or consult with an attorney in your area about any specific requirements for where you live. And with that, I'm going to pass it off to my colleague, Ian.
Hi there, my name is Ian Anderson. I'm the Legal Services Project Director at Transgender Law Center. My pronouns are he, him. I'm here to talk about advanced directives a little generally. So what are advanced directives and why are they important for trans people? Advanced directives, in a nutshell, are legal documents that will explain your wishes if you become seriously ill, incapacitated, or if you pass away. I want to stress that advanced directives are one set of tools you can use to try to prepare for emergencies, to try to communicate your wishes with your loved ones and with doctors. We'll talk about some other strategies you can use more broadly to prepare for medical emergencies in these kinds of situations. I also know that a lot of people who might be listening to this call may have experience navigating or helping others navigate medical emergency planning. So we definitely encourage you to chime in the chat box, and we would love to share some of your thoughts as well and your wisdom later in the call. So like I said, advanced directives is kind of an umbrella term. They refer collectively to a number of individual documents like the medical power of attorney documents, living wills, They may include instructions for your wishes for depositions of your remains. And so we'll talk about a little bit more in detail about the specific documents one by one as we go through this call. These documents can be especially helpful to trans people because they can grant people, apart from your biological family or spouses, power to make decisions for you in a moment of crisis. Your chosen family may not otherwise legally be able to see you if you're sick or in the hospital, or to ensure that you have received the care that you want. So these can be especially vital for folks in our community. Advanced directives can also be really helpful in ensuring that your gender is respected, even when you can't advocate for that yourself. It can be hard to advocate for ourselves even under the best circumstances, but if we're sick or, if we're concerned about or we're feeling isolated, right, in a medical situation, I think that becomes all the more vital. If you're put on life supporting care that prevents you from communicating or you become unconscious, these kinds of documents can tell people what kind of care you want broadly and specifically, how your financial affairs should be managed, and they can ensure that people know about your pronouns and your name, even if you haven't legally changed those. If you pass away, advanced directives can also explain how you want to be dressed and spoken about, after death, as well as explaining how your property should be divided. So like I said, we'll go a little bit more into detail about these specific forms of advanced directives over the course of the call. So again, why is it helpful to prepare advanced directives? A little more detail. I think advanced directives, again, are useful for many trans people in particular because many state laws generally only give power to make decisions about healthcare to either biological family, married spouses, or hospital boards. A lot of the people we would want to be making those decisions for us, don't necessarily fall into one of those categories. So it's really, really vital that we try to make some plans for those kinds of events. They can also ensure, like I said, that our correct name, pronouns, and gender are respected, even when it's difficult to advocate for ourselves, especially knowing that our health status may rapidly change. So really vital to have that planned ahead. I think people are really interested to know where they can find sample advanced directive documents. It's really nice to be able to see a template to know something to build off of. This can be a little tricky because the laws for what's required in these specific documents does vary state by state, as Dale mentioned. So there's not really one standardized form we can point you to. Thankfully, there are sample forms that have been developed for every state, though, through AARP's website. We'll link to this in the chat box. We encourage you to check that out to look there for specific language and some more guiding instructions that you can look for when you're putting together these forms. So generally speaking, again, this is a little bit of a generalization because the laws may vary state to state. You'll generally need at least 2 adult witnesses who are not related to you by blood or marriage, who can sign the form as a witness. You may also need to notarize the forms. Now, admittedly, this can be a little tricky in these conditions because a lot of offices that may otherwise be open may be affected by shutdowns or other kind of orders. So, I think it's important to check your specific state's laws, which again are available through some of the resources that we're providing in the chat. It's also worth noting that notarization can often be done at a bank, which may be more likely to not be affected by some of the shelter-in-place orders. But again, I definitely encourage you to check the specific laws in your state. So I also definitely want to stress, just as long as we're talking about general points about advanced directive documents, it is like half the battle of setting up an advanced directive is communicating it and making sure that it's accessible. So even once you've gone to the effort of writing things out, of getting the witnesses and or the notarization, it's still really, really vital to tell your loved ones that you have plans in place, to share these documents with your friends, with your loved ones, anyone who may be involved in your future care, and also to keep a copy for yourself in a safe and accessible place. Some people will have it on their refrigerator or on the back of their front door. This is often in case there was a situation where first responders might need to check for these documents. These might be some of the first places they look. We're also living in an increasingly digital age. It might be helpful to have a copy of this on your phone as well, or to send it to copies of your friends even digitally. Again, any steps you can take to share these documents with people that you trust in a safe way, we definitely encourage you to do that. There may also be electronic registries where you can actually post this online. The California Secretary of State, for instance, has a sort of database of medical advance directives. This gives you a place to share those documents so that they're easily accessible by a wide range of medical professionals if it should come to a situation where you would need to use that. So that is my sort of general reflections about advance directives. I'm going to turn it over to my colleague to talk about living wills.
Wonderful. And during that moment, we will switch ASL interpreters.
Hi, everyone. My name is Lindley Edges, and I am the legal director here at the Transgender Law Center. Today, I'm going to talk to you a little bit about living wills. As Ian already talked about, advance directives is a kind of an umbrella term, and then there are sometimes specific documents within that. And one of those is a living will. And what is a living will? Well, basically a living will is created so that you can explain what your wishes are if it comes to a point where you're unable to speak or express yourself and let a doctor or nurse know what you want to do for your medical case. So, for example, if you become unconscious, if you develop a mental disability that impairs your ability to communicate at all, the doctors and nurses and other medical providers need to know how you want to proceed, whether or not you want things like CPR, whether or not you want certain types of pain medication. And so this document can be really helpful to ensure that your wishes are followed by medical providers in a hospital. But that's not just what it does. It can actually do a lot more and provide a lot more information. So I get asked a lot, why is it important for trans people to have living wills? Well, it's important to express specifically what people would want to happen if they are unable to express themselves, but also not just about medical issues. Specifically, you want to make sure that you can tell the medical providers what name you want to be, what name you want used, even if you haven't legally changed your name, what pronouns should be used. It could even provide information about how you would want funeral arrangements. And it can also, something that's also super important, it can make it clear who you do not want making these types of decisions for you. So if a family member like a brother or a parent is there, if you have in your living will that you don't want that person making that decision for you, that living will give the medical provider the ability to allow someone else to make that decision. So for what types of things should be included in living wills? Well, one of the important things is you can direct medical staff to continue with hormone therapy as long as it doesn't seriously interfere with other necessary medical care. Sometimes, if that isn't written down somewhere, a doctor, nurse, or other medical provider might not know that that's important to continue. You can also make sure that the hospital staff uses the correct name and uses all the correct pronouns. What happens if you don't have a living will? Well, if you don't have a living will, then the judgment of what should happen to you could fall into a lot of different places. It could be a parent or a sibling could be called up and asked to make those decisions. It could also just fall on a funeral director to make decisions of what that funeral director thinks should happen. It could also be just the medical providers making that decision without any information from you. It's important when you decide who you want to make these medical decisions that you include that in your living will. And what that's called is a healthcare proxy. And we're going to have someone talking a little bit more about healthcare proxies. So I'm not going to go too much into it. You do not need an attorney to complete a living will. There are a lot of samples online, and there you can also ask us any questions you have about what is acceptable or not acceptable to include in your living will. But if it's something you're thinking you want to include, there's nothing wrong with just including it. You can use those samples and just fill in your own information in that living will. Generally, you need a witness. You need two people to act as a witness for a living will. Within the times that we're in, that might not be possible right now. A lot of us are by ourselves, and it's difficult for us to engage with other people. So it's okay to feel creative right now. So if you create a living will now, and you send it to a friend and ask, can you be my witness? You can try something like that. I feel like medical providers are actually really wanting to know this information. So they're willing to take, and they understand that we're in a time where we might not be able to access another two people to sign documents for us. So as long as you can show that you've tried to do this, I'm guessing that a medical provider will be just happy to have that information for you. If you can change or revoke a living will, you might make a decision about something that you think you want right now, and then 10 years, you look back at that living will and you realize your feelings completely changed. Sometimes people change their mind about the types of medication that they want or whether or not they want CPR. That's okay. You can actually just revoke or cancel your living will and create a new one, and that's totally fine as well. The next thing that we are going to talk about is hospital visitation. So I'm going to send this over to my colleague, Milo.
Hi, I'm Milo. I'm a legal fellow at TLC, and I use they or he pronouns. And I'm going to talk about hospital visitation directives. Hospital visitation directives are documents that simply state who's allowed to visit you in the hospital. When someone is incapacitated, hospitals can visit and get information about that person. And this is usually limited to biological family and legal partners. However, many members of the trans community have loved ones who are chosen family or people who are very important to them, but who are not necessarily recognized as such by law, who aren't biological family or married spouses. So hospital visitation directives are really helpful for folks with chosen family because they allow that family to have a legal right to see you if you're unconscious or otherwise able to voice your desires. And making one, you don't need a lawyer, you don't need a notary. You should just be able to get forms, draft it, filling in who you want to be able to visit you. And then you and two witnesses should sign it. And as Lindsay already discussed, we can sort of try to be flexible about that and do that as much as we can these days in these really particularly trying times. We have a sample linked in the guide, which you can just go through the website. It tells you how to fill everything in. So hopefully that should make it pretty straightforward. And once you've completed that form, it's important to send it to people who are listed on the form so that they can bring it with them to the hospital. And also try to make sure that that form is accessible to medical providers or anyone else who might need to be made aware of it. So that is hospital visitation directives. And now I'm going to pass it back to Dale, who's going to talk about power of attorney.
Thank you, Milo. As Milo said, I'm going to talk about power of attorney documents. Power of attorney simply means you're granting someone the power to make decisions on your behalf in the event that you're ever incapacitated or otherwise unable to make decisions for yourself. So a medical power of attorney document allows you to appoint someone that you trust to make medical decisions if you are ever unable to. Sometimes this is called a healthcare proxy or a healthcare agent. This appointment only becomes enforceable if you yourself are unable to make medical decisions. So if you are able to make decisions, your healthcare agent will not have the power to make medical decisions for you. It is important that you appoint someone that you trust. It is also very important to talk with the person that you appoint about your wishes. It is a lot of responsibility to make medical decisions on behalf of another person. And this is one reason it can be very helpful to have both a living will and medical power of attorney. Your living will really is a gift to your healthcare agent. It provides them with concrete instructions about your care. And for that reason, the more specific you are about your instructions, the more helpful it will be to your agent. I recommend going over your living will with your healthcare agent and talking through what parts of your care are most important for you. When appointing a healthcare agent, in addition to thinking about trust, it can be helpful to think about physical proximity. There are advantages to having somebody geographically closer to you to be able to come quickly in the event of emergency. That's not a requirement, but it's just something that's important to consider. You can also appoint an alternate healthcare agent in the event that the agent you appoint is unwilling or unable to make decisions for you. And this is important because transgender and gender nonconforming people, absent appointing somebody, hospitals will look to birth family or legal spouses as next of kin to make decisions on your behalf. But for many TGNC people, chosen family may be the people that we trust the most. Also, in some jurisdictions, hospitals and medical boards will make critical decisions about your care if there is no healthcare agent appointed. And furthermore, in some jurisdictions, including New York State, the medical decisions that a healthcare agent is empowered to make are much greater than decisions that next of kin could make absent a power of medical attorney appointment. So the best way to ensure your self-determination of your care is to have both a living will and to appoint somebody as your healthcare agent who knows about your wishes. So we know that the healthcare system is transphobic, ableist, racist, and classist. And by planning in advance with someone that you trust, your healthcare agent can act as your advocate when you are most vulnerable and compromised. So for example, in addition to instructions about your medical care, as my colleague stated, you can also include wishes about pronoun usage and using your correct name in your living will, and talk to your healthcare agent about ensuring that all providers are respecting those. You can also appoint a financial power of attorney. This allows you to give somebody the power to make financial decisions on your behalf if you are ever unable to yourself. This can include the ability to bank on your behalf, to file taxes on your behalf, or pay bills, anything that you do financially. You can tailor this document to be as specific or broad as you like. And again, this is important for TGNC people because we may trust chosen family more than birth family. For both medical and financial power of attorney documents, you will need to take certain steps to ensure that they're enforceable. Although I encourage you to go ahead and create these documents regardless of whether you're able to meet those requirements, as my colleague stated. In some states, you need simply 2 witnesses. In others, you might need to get it notarized. So you should check with your state's requirements. And the resource includes a link to a website that provides state-specific information about how to create yours. Both financial and medical power of attorney documents are very powerful tools for self-determination. And now I'm going to pass it off to Lindley to speak about things that are important to bring to the hospital.
Thanks, Dale. Just to echo something Dale just said about being able to have an alternative medical power of attorney, it is more important than you think. It is something that I recently had to deal with, was figuring out who could make a medical decision when a close friend was in the hospital and the original medical power of attorney or medical proxy wasn't available. So thankfully there was an alternative person put there. So I just strongly encourage people to consider having an alternative person. So what's important to bring to the hospital? At this point, I'm just going to be very transparent. I live in New York City. So what I'm seeing might be very different from other people's experiences. But in New York, when I have friends who are now going into the hospital, many are going in by themselves and they are unable to bring anyone with them. So it's important to have all the information and documents you need so that you can advocate for yourself, or you can at least hand that information to a medical provider so they can see it. So what documents should those be? Well, any legal documents around life planning, any of the documents we just talked about, an advance directive, a power of attorney, visitation, all of this will be important to have a copy with you and to make sure other people in your life have copies of them themselves. You might want to keep a name change order with you if you've changed your name, a gender change order or a doctor's letter or any type of ID that's affirming your gender. It's good to have that with you in a bag. Keeping a printout of people, of close people and important people's phone numbers is really important, because that's something that a medical provider can see. And if you're unable to communicate, it's easy for them to see exactly who they should be calling up next. This was, the next item was suggested to me by a friend that it might be important to keep a photo of yourself. Bringing a photo of you with you can be helpful so that the doctors and nurses and other medical providers who are treating you actually can see a little bit more of who you are and not just see the person in the bed. And this is just a way to humanize yourself to your medical providers. You might also want to keep a couple photos of friends with you. People are going into the hospital by themselves, and it might be helpful to have some friendly faces posted in your bed with you. Also, a list of any medications that you're on, a list of any surgeries that you might have had. This can be important if you're unable to communicate this information to doctors, just in case there's like a procedure where if you've had a pin put in your ankle, if they don't know about that, it could impact other procedures that they might need to do. So just keep that in mind. Also, it's important to bring a phone charger and any chargers to any types of electronics that you're bringing, because that way you can continue to communicate. And it might be difficult at this point, at least in New York, to have any visitors come and bring you anything at all. So people put this together beforehand. So if they need to go to the hospital quickly, that bag is already ready with all of this information. So I know there's also other people who might have other ideas of what's important to bring with you. Please bring those ideas into the Facebook chat. This isn't a comprehensive list, and the more people who share what other options is going to be really helpful, so that we can create more of a comprehensive list. So we have a couple practical tips that we want to share with you, and to do that, I'm going to pass this to my colleague Ian.
Thanks so much, Lindley. Yeah, and I just want to chime in to add to something that you mentioned before it gets away from me, specifically on the phone charger point. As somebody who has spent a fair amount of time in hospitals, thankfully prior to COVID, I will just say on a personal note that having an extra long phone charger can be especially useful, because you don't know how the bed will be positioned relative to any outlets that may exist in the room. So I just wanted to, again, kind of return us back to thinking about this moment in time as an opportunity to think a little bit more broadly about community care and about kind of communicating with the people who are close to us about the kinds of planning we can do to prepare for a wide range of different kind of potential challenging situations, emergencies, health crises. We talked a little bit about hospitalization or a situation that might require hospitalization, but it's also important to note that people are sick for a variety of reasons. There are, mental health crises that are happening in our community. People may need a wide array of different kinds of support. I think we all can use different kinds of support in this moment. So I also just wanted to contextualize this conversation of, talking about specific advanced directives within a broader kind of set of strategies that we can use around how to communicate with our loved ones about the kinds of care we might need and the kinds of things that we might want to think about in advance of a crisis or in advance of a time when we might kind of need an especially high amount of care. So I just wanted to share a few elements of a community support plan that was developed by the Black Emotional and Mental Health Collective. There's many different approaches to community care, to mutual aid. This is just kind of one set of things that we might want to think about, when we're thinking about community care and support. So this idea is essentially, it's a sort of checklist that you can fill out to think through a couple of things, and then to share that checklist of information with a couple of people in your life who you're really close to and who you want to share this information with. So the first item that you could think about is just having a short list of friends or family that you would like to be contacted in the case of an emergency. Again, this can include whatever kind of contact information is most helpful for actually reaching those people. It can be as extensive or as short as you want, but just having a couple of emergency contacts on a written list. Having a kind of broader meals or food support team. We might be in a situation where we're in our houses, we're confined to our houses, but if there's somebody who is able to bring us meals or have meals delivered to us, who would be kind of on that team. On that kind of list, it's always really useful to include both any allergies or food restrictions you may have, as well as, on the other hand, food that brings you joy or comfort, right? I think in these kind of situations, food can be such really powerful in terms of healing too, right? The third item would be medications that you're on. I only gestured towards this in terms of a hospital preparedness list, but in any kind of situation where you might need others to take care of you, having a list of medications you're on or procedures you may have had that doctors or others need to know about. Information about doctors or therapists you may be seeing, right? And any insurance info if you have insurance, right? Having this information collected together can be so helpful in terms of making sure that you get the care that you need. A broader support team and their contact info for either phone check-ins, home check-ins, hospital visits, whatever it may be. Again, it's important to make sure that you have information about people who are allowed to visit you in the hospital, but it's also great to have a kind of broader support care team. And then finally, support for your literal children or fur babies, pet or child care support team, including any pet or child care doctor info, food info for your kids or pets, etc. So these are just some things that you can be thinking about, and again, kind of documenting and sharing with people that you love. It's a lot to think about. I also recognize, a lot of folks in our community are isolated and maybe kind of feeling especially isolated at this time. It's important to note there's no rules about how extensive this plan needs to be. Even having a few contacts that you're sharing more information with, it's so helpful. Similar to the advanced directives, the formal legal documents we were talking about, it's so key to communicate with your support people about this information, right? If you don't share it, then it's only so useful. I want to also just stress, we've shared a lot of information today. We've shared a lot of options. Definitely want to encourage folks, don't let the perfect be the enemy of the good. Any steps you take to prepare for any kind of these situations is fantastic, and it's a huge step forward in terms of making sure that you and other members of our community are safe. And I think the last point I just want to say is, I know thinking about this stuff, as Gail mentioned, can be scary, but it's also the more that we're having these conversations, the more we can break down the stigma, right? The reluctance in our society to talk about these kinds of things. We can all break down isolation, right? We can share hey, I trust you. I want you to help me with this process. I want to help you with this process. We can make sure that we can keep each other safe. So I would love to turn it over to folks who have been monitoring the Facebook chat to see if there are any questions that we want to share together, or any suggestions that people have shared in the comments. So I think I'll go back to Swai. Thanks so much.
And I can answer one of the questions that...
Go for it, Lindley.
Oh, sorry. Okay. So I can answer one of the questions that just came my way, which is there a number of people you can have listed as visitors? No, there's not. You can list as many people as you want on your visitor sheet. And to be honest, it's better to include more people than less. And then the other part of the question is, even if they're visiting one at a time in accordance with whatever the hospital policy is. So yeah, as long as you're following the hospital policy, you can include as many people on that list. Please be aware that at this point, visitation might not be available in certain hospitals For example, in New York, people are not allowed visitors at this point. So in general, it's always a good idea to have a robust visitor list. In practice right now, it might not be as helpful in places that are not allowing visitors.
Thank you, Lindley. Thank you to the whole legal team. Thank you, Dale, Milo. I wanted to maybe slow down a bit and have folks take a breath. I know this was a lot of information and a lot of information that can bring up some emotion. So if we could just take a breath for a second and also allow folks to have some time to put in some questions in the chat box. So we had a couple of folks ask if this video will be on our Facebook beyond the live, and it will live on our Facebook, and it'll also be posted in our COVID resource page, which has the recordings for past lives as well. In the past weeks, we have done a live with Black trans femmes on the front lines of the coronavirus crisis. We had a virtual vigil last week. So you can check all of that out on that page on our website. You can find that in the comment section. If you do have a question or a comment, you can add that now and we'll be sure to address it. For the person who's asking if this will be done in Spanish, we have Spanish interpreters who are doing simultaneous interpretation. And we also plan on having that interpretation recorded for this purpose. As for the resource itself, I'm unsure. So the legal team, do you all know if this resource will be provided in Spanish?
It is something that we hoped to translate into Spanish soon.
Okay, cool. So the resource will be translated into Spanish soon. Thank you, Lily. Anyone else have any questions, comments? Awesome. So if you do have any questions, I'm seeing another question come in. Do you have any advice for this kind of planning in current pandemic times for undocumented folks? Would anyone like to take that?
I can take that. Even for undocumented folks, for everyone, it's important to have these types of documents so that your information can be, and your wishes can be respected by all people, medical providers, family, anyone and everyone, regardless of immigration status.
Thank you, Lindley. We have time for a bit more questions. If you have any, you can throw them in the comment section and we'll answer them live. Okay, so it looks like folks are okay for now. If folks do have more questions, you can continue to type them in the comment section if you're watching this after it's been posted, and we'll do our best to answer them as well. Thank you again to the legal team for being on this call and giving us really crucial information. for next week, we'll have a call from our disability project speaking on how the coronavirus crisis has really revealed how ableism runs our world. So in the meantime, I hope everyone stays safe and has a peaceful weekend. Thank you all.
Thanks, bye.